Hi, my name is Anya Pintak and I am Program Manager of the Global to Local Connection Desk. So I started off with Global to Local as a Master's in Social Work intern last year, and I was interested in global health and social work together, and I found Global to Local, a fairly new nonprofit organization down in South King County that utilizes global health strategies to improve health disparities in the South King County area. And so I approached Adam Taylor, the program director, and he had this project in mind in which a group of students from UW and Seattle University could act as social resource specialists for South King County community members and Health Point patients. Because there was a lot of providers were noticing that Health Point patients needed more than just medicine to keep themselves healthy. They needed additional resources such as housing, utilities, childcare, daycare, ESL classes, a breadth of social resources that they were unable to connect them with because they did not know where they were, and additionally there was only one CSR, client services representative at Health Point. There is actually a model in the East Coast called Health Leads, which utilizes undergraduate students, and undergrad students act as social resource specialists in larger hospitals. I took that model and I researched regarding, okay, how can we take this idea and make it smaller so that it works for our South King County community.
Hi, I'm Colleen Brandt-Sluter. I'm the Human Services Manager for the City of Seatown. Our community is incredibly blessed to have Global to Local Connections desk here. One of the things that we've, having worked in this community for some time now, probably close to 20 years, I realized that most people really need to have relationships in order to trust and to be able to understand the resources that are available. And so having a place where people can call or people can literally walk in and talk to somebody that can help them navigate systems in their own language is so personalized, and the results are so much stronger. We are able to see people actually access those resources, where oftentimes the barriers to just getting a referral and information, making those connections are really difficult for our families. So having a bit of that hand-holding and a bit of that personalized opportunity to come in and have someone actually work with them has been tremendous. I think real change happens when people make a personal connection and people understand how to access a resource. It isn't just about giving a person a piece of paper with a referral on it. It's really about helping people make connection and make access to the resource, and I think that's what our Connections Desk does.
Hi, my name is Grace Sandoval, and I'm the Outreach Coordinator with Health Point. I feel that the value of the Global to Local Connection Desk is really the word connection. The volunteers have this capability of being one-on-one with our patients and making sure that they're actually connected to the resources that they're offering. In our position at Health Point, we're very busy helping these patients with any of their health conditions and managing their health care, and helping them connect to any other community resources like financial resources, housing, childcare, anything like that. It's very difficult to make sure that they actually get connected, and that's, to me, that is the actual value of the Connection Desk. They're there one-on-one with the patient and making sure that they actually get connected to that resource. So the new Affordable Care Act has made it possible for Washington residents to apply for affordable health insurance coverage. Washington State has expanded Medicaid to a new adult population that wasn't previously eligible, and they're also created a marketplace, an online marketplace where there's a whole bunch of new plans available for people between a certain percentage of federal poverty level to purchase health insurance based on their income. And there's tax credits and cost sharing available so that patients can help reduce some of those healthcare costs, both the premiums and then their out-of-pocket costs. So this is a huge movement in Washington, and Health Point is so excited to partner with Global to Local, and we're certifying 30 plus people to help people enroll in insurance. And we're excited to do community events. We're doing events at our clinics. We're opening it up to as many people as possible, because the whole goal is anybody who doesn't have insurance can now qualify for free or low cost health insurance. And bottom line, we want everybody to enroll.
Hi, I'm Evie Boykin, and I'm the Human Services Manager for the City of Tukwila. People experience many different barriers when they come to the U.S., much less coming to the Tukwila community. And part of those barriers have to do with systemic barriers. So where are the opportunities that they have to meet their needs? So for example, if they don't have adequate transportation, they're going to have a tougher time being able to get to a job, do grocery shopping. They may not find the selection of those foods that they're used to eating, so they may be challenged by the acculturation issues as well as the access issues. The kind of work that the navigation desk does is similar in some ways to some of the work that we do. And to begin with, I have to say that I've been incredibly impressed by the passion and the commitment of the students to work the navigation desk. The link between HealthPoint and the navigation desk really represents a new way of looking at health in a broader perspective. The ability of the patients to get this kind of assistance actually supports their own growing confidence in how to address their own health care needs. So this kind of as a pilot, in the face of what's going on with health care reform is really very exciting. And I feel like I have good friends at the navigation desk.
Stephanie, English. Taylor, English.
Ruby, Nepali, Hindi, Maithili.
Jasmine,
tiếng Việt.
Eric, Akan, David,
Francis,
Morgan.
Annie,
Jose.
Espanol. Chica, La Francais, Naivo.
Michelle Amharic.
Jennifer, Chichao.